We've been bombarded with messages telling us to watch our salt intake, but as Dr. Peter Salgo reports, that message might not be for everyone.
If you're like most Americans, you probably think that salt is bad for you. Not that people have stopped using it, mind you, but a lot of us feel guilty every time we shake a shaker. Now Dr. Lawrence Resnick of Cornell University Medical Center and New York Hospital says most of us don't need to reduce our salt intake at all.
It's potentially harmful in about half of the people who have high blood pressure, and as far as we know with respect to blood pressure, no one else.
That translates into some interesting numbers. Of every 100 Americans, Dr. Resnick says, 70 have normal blood pressure and can eat all the salt they want. Of the remaining 30 people who have high blood pressure, only about half, or 15 or so, have to watch their salt at all. They are so-called salt-sensitive hypertensives. The other 15 can eat salt without fear. Dr. Resnick says that the fear of salt many of us have is not our fault. Salt has become an obsession with Americans, largely because the government and a few large medical groups wanted it to be. They've been saying all along that all Americans should be urged to eat less salt, even though they knew all along that less salt would only help some Americans.
Whenever you try to get the message out, you always tend to generalize, and the generalization from a scientific point of view is inappropriate.
If you need proof, look no further than Irwin Rubin. He's had high blood pressure for 15 years. If anyone should watch his salt, you'd think it would be Irwin.
For 2 months, I had minimum salt, 2 months regular salt, and 2 months I had 3 or 4 tablespoons full of salt a day, and there was absolutely no difference in my blood pressure.
In most people without high blood pressure, it doesn't make a bit of difference how much salt you eat. And in half of the people with high blood pressure, it doesn't make a bit of difference how much salt you eat.
Salt has certainly gotten an evil reputation. I would say that most of the reputation is unwarranted.
Some people get dehydrated when they go on low-salt diets. They're more prone to getting strokes when they go on low-salt diets. If they're runners or exercisers, they have decreased exercise tolerance on low-salt diets.
High blood pressure is an abnormal sign of something going on under the surface. It's not caused by the same thing in everybody. It's a heterogeneous sort of thing. It's sort of like a fever. Not everybody with an elevated temperature has the same reason for it. Our general approach is to try to individualize advice for individual people. You always get into trouble making blanket statements for large populations saying everybody in the country should do this or everybody in the country should do that.
Scientists at New York Hospital have made an important life-saving discovery about the mineral calcium.
The new study shows that by adding these calcium pills to your diet, or extra calcium in other forms, you can actually lower your blood pressure if you have moderately high blood pressure.
The exciting thing is we can actually now distinguish beforehand for whom calcium might be good. We can use simple measurements of, for instance, the free or ionized levels of calcium in the blood, or of a certain hormone, blood pressure hormone called renin, to distinguish those patients where they'll be extremely sensitive to extra dietary calcium and where calcium will have a big effect on lowering their blood pressure.
Dr. Lawrence Resnick of the Cornell Medical Center has uncovered evidence that a diet rich in calcium may offset a diet rich in salt.
These people may have an option, and that option is going on an increased amount of dietary calcium intake, which can either be in the form of food products or in the form of calcium supplements, and that they may achieve a similar benefit with increased amounts of calcium as they would have with decreased amounts of salt. Calcium lowers blood pressure best in those patients who are sensitive to salt. Where salt would be bad for them, calcium tends to be good for them.
We had a black woman who came to us because her doctor could not adequately control her blood pressure with 2 or 3 different medications. And she is currently on no medications, is only on calcium, and who actually every Sunday tries to get the church to come to us on Monday.
Based on our measurements of levels of magnesium inside the tissues, where it's actually working, we think that it's reasonable that at least a third to a half of people with high blood pressure are deficient in magnesium, and that in those people, replacing the magnesium they're missing is helpful.
What do we get it in? Why aren't we getting it in our diet?
Well, if you like chocolate like I do, and you eat too much of it like I do, you may be getting enough. But it's present in foods that are healthy for us in general, such as nuts, almonds in particular, such as in all green vegetables. You have to eat a lot of green vegetables.
What's a lot?
More than I eat.
More than most people eat?
Probably more than most people eat on a routine daily basis. That's right.
Do you take magnesium supplements?
No, I eat too much chocolate. I'll answer that in two different ways. First of all, I think people should stay away from doctors if they're not sick. Far too many people go to doctors for far too many reasons that they would turn out, which would turn out to have been better taken care of by not going to the physician to begin with. And people who do not have any known medical conditions, people who feel well and who don't have any particular reason to go to physicians ought not to be spending their time worrying about how much sodium, potassium, calcium, magnesium, or anything else is in their diet, for that matter.
I can hear all kinds of people out in our audience cheering at that statement. So
high blood pressure or hypertension is an old-fashioned internal medicine disease. It occurs in patients with a family predisposition, and it occurs in people who are thin as well as obese, in people who are calm outwardly as well as inwardly, and in people who are on a variety of diets, whether or not they restrict their dietary salt.
Okay. Hypertension is not related to tension as we experience it. The disease high blood pressure is not just a mental state type disease. And, I don't believe in global recommendations, but lots of the controversies in medicine come from trying to apply something that's appropriate for some people to try to apply it automatically to everyone.
In America, we oftentimes consider that we have lots of diseases because we eat too much of something that may very well in and of itself in reasonable amounts be fine. Cholesterol by itself is a controversial area which luckily I'm not usually asked about.
Short and sweet. Thank you so much, Dr. Resnick.
Thank you.
You heard it from the doctor. Keep your weight down.
Nobody gives you credit for doing human research. They don't think it's scientific enough, but when you do a rat research study, since doctors don't take care of rats, they think you're very scientific if you do rat work. Many of you are told that salt's bad for your blood pressure. That's almost true sometimes in some people. Some people think the world revolves around their favorite ion. So some people are magnesium people. And for 30 or 40 years, they've been doing research showing the importance of magnesium in everything. Some people are intracellular pH people. I'm about to show you intracellular free calcium measurements by NMR spectroscopy and intracellular sodium measurements and intracellular potassium measurements. There is no such thing as one ion or one mineral ion system that is critical for the kinds of functions I'm describing. They're all critical. The knee bone and the thigh bone are connected. It's arbitrary which description of nature one chooses because, as I will show you, they're all connected. Nowadays, in medical research, nobody wants to find the cause of a disease. They assume the molecular biologists are going to find the gene, and that'll be it. People are interested in identifying, and you can get a lot of money for identifying risk factors. Causes of diseases are passé. They're too hard. More recently, if one adds together all of the ions that I've talked about, we have what I modestly call the ionic hypothesis of cardiovascular and metabolic disease. And we believe as a current working hypothesis that this ionic hypothesis is the most economical way of trying to tie together the leading causes of cardiovascular disease in Western countries. So with those things, I thank you very much. Thank you.